so that your light, the window is in front of you and not behind you. Or pull the curtains. Yeah, that's it. You see, it's much better now. You can see your face well. So the light will not interfere. So, Mbodo there.
Here you go.
There they are. Okay. Udiana, as you know, see, I can speak your language small.
Yes, I can hear you.
Yeah. So were you among those that were in Delta?
In Delta, when?
For this past week for maybe it's only for the directors in the ministry in Delta State.
Okay.
I wanted to know so that I don't
know.
repeat a presentation.
Okay. Those were in the ministries. I was not among them.
No, I'm asking because I need to know who were there.
Well,
I need to know those who were
sure.
there. Okay. So if you're not there, then that's fine. That's fine. I don't have a problem. I just want to be sure that I won't be repeating a lecture that's been delivered before. So we can use that time to do other things. Let's see how many people join in. The only person joining in the class for now. Hello, Susan. Susanna. Susanna Solomon, how are you?
I'm very fine, sir. Good evening, sir.
Good evening. Yeah, I'm meeting you guys for the first time. So can I have you guys introduce yourself and so we know how, and let me know how this class will benefit you. Okay. Let's start with Iyeme Edemokon. Iyeme, can you introduce yourself and let us know how this class will benefit you? That will help me narrow down my presentation to fit your specific or unique situations. Please go ahead.
Iyeme Edemokon, social worker, Akobo local government, assistant director.
Okay. All right, thank you very much. So how do you think this course will help you? This is social work programming course. How would it help you?
It will help me to, in fact, improve on my career as a servant, civil servant.
Okay. Help improve your career as a visual analyst. Okay, that's good. So you're looking at it in terms of career improvement, and I mean that could also mean career progression. All right. Susanna.
Yes, sir. Yes, sir.
Yeah. So introduce yourself and tell us why why you take this class.
Okay, sir. My name is Susanna Solomon. I am a director from Oruko local government of Akwa Ibom State. I'm
Okay.
a social worker, sir.
Okay. All
Okay,
right.
so
That's good.
this class will help me improve in competency. It will improve my competency while serving the public and maybe offer clarity to most of my questions and challenges, sir.
Okay. Well, thank you. So you're looking at it from a competence perspective so that you can respond to the needs and things in your office. And so it's all right. That's great. That's great to know. So far, we only have two of you on here. So I don't know how many people are in this class and what's going on with them. So I want to just go ahead and start the introduction because we have quite a lot to cover. So please, when you need to ask a question, it will be good to either since you're all taking up video to be able to help the bandwidth so that it doesn't slow it down, which is great. I'll leave my video on, but I'll recommend that if you have a question, unmute and interrupt and ask the question so that we can address it. Okay, don't feel that since I can't see you raise your hand, but if you unmute and ask your question, I will stop and then respond and continue from where I started. How does that sound?
That's great, sir. Thank you, sir.
So we'll be looking at a PowerPoint presentation. I'll have the presentation queued up and ready to share. Then I need to move the PowerPoint to a different screen. Okay, so that I can easily share it when the time comes. Okay, so I'm going to share the PowerPoint, and please let me know if you see it. I'm sharing it now. If you see it, tell me what you see. Can you see my screen? Or
Very well, sir. Yes, sir.
what do you see?
Okay, in the background, I see a couple of codes. Then social work programming,
Okay. Okay.
SWK-MCP
All right.
701.
Thank you. I wanted to be sure because I have two screens. Sometimes it comes up and it's the screen that I am on that is showing and not the presentation.
All right, sir.
So let me state now, because I have two screens, one screen is looking straight at you, that's the camera screen, and it has your names and things so that I can be seeing that all the time. But the screen on my left here is the one that has the presentation, the slide. So I will try to put it on and so that we can see and start the presentation. Let me see how it would work. So now tell me again, it's on slide mode now. Tell me again which slide you see. Do you see the full slide or you see a small slide and another smaller one?
It's just a slide, sir. Just one. Social work
Just one.
programming, SWK-MCP. Bye.
Okay. All right. Thank you. So that's another then. All right. So this is a bit slow, but we'll go on. So the course is Social Work Programming, SWK-MCP 701, and it is where we try to introduce ideas into social workers to know that, whether it is in the office or in the community, and then you should go into social work with a programming approach. So when you go into social work with a programming approach, you would be able to get ideal and adequate results because you're following certain structured way to do those things. So you don't just wake up on the morning and they say, oh, there is a child that has been abandoned somewhere. And for example, a child abandoned somewhere and you have to go and attend to it. So you carry your notebook and things and start heading to go see the child. You need to understand certain aspects. What are the preparations and things and how you're going to now go and see the child and what they're going to be doing to ensure the child gets what's it called? Get the right attention and that you follow the right procedures as well. So let's go on to the next slide. I don't know why it's taking so long to do this. Okay. So now we go on to introduction. Usually I divide this class into weeks. And because you people are used to taking notes as opposed to jotting down main points, I decided to do the couple of slides with writing so that if you want to take notes or if you want to take a picture to capture it, capture the screen if you're not using your phone, and then you can also capture the screen. And so that, because I think this would also be, this is being transmitted live, so you can be part of it, and you can have this later on to review, especially when it comes to studying on your own or designing your programs. You have reference materials to use. So the introduction on social work programming, like I said earlier, it is to get you prepared as you go on to implement or to do your work, because your work in social work is actually a program work. It's not just a desk job that you sit and write and submit and get a report and write again. So it is a critical pillar within the broader field of social work, serving as the framework through which social workers identify, address, and resolve a wide range of social issues. At the core, social work programming refers to the systematic planning, development, implementation, and evaluation of organized activities, services, or interventions designed to enhance the well-being of individuals, families, groups, and communities. These programs are tailored to meet the specific needs, foster empowerment, bridge gaps in service delivery, and promote social justice and equity. So that's a brief introduction of this class, and so on. Now, but when you go into defining social work, social work programming itself, you need to look at a more broad and encompassing spectrum. So it's an encompassing spectrum of intentional and structured interventions designed to support vulnerable populations and address systemic societal challenges. It's important to know that when they say address systemic societal challenges, this is a very overwhelming thing for the social worker. So it doesn't mean that you have to go and address it, but through your programming, you can pull together the resources and the advocacy approach to be able to address those systemic societal challenges. So these programs can take place in various settings such as schools, hospitals, community centers, correctional facilities, and non-profit organizations. The essence of social work programming lies in its holistic person in environment approach. When we say holistic person in environment approach, we mean looking at the person in the environment they live in, but looking at the interconnectivity within that environment and the pressures and factors around there that influence that person. So you look at that as a whole, which acknowledges the complex interplay between individuals and their environment and strives to cultivate positive change at both the micro and macro levels. Micro means within the person to shape positive change. Macro level means beyond the person. Because sometimes the things we do encourages change beyond ourselves. So that's the macro look at it. So that's a broad definition. Now, for a core definition, social work programming is the strategic process of designing and implementing organized services or activities based on evidence and community needs to improve the quality of life and promote the rights and dignity of individuals and communities. So when the first slide introduction and the definition were put together to come up with a core definition, and we talked about the strategic process of designing. So strategic means it is well structured. You look at it and you plan it effectively, taking into cognizance the different aspects or the different inputs, the different drivers of it. So I give you an example as a program using a mundane thing like you waking up and deciding, both of you are from Akwa Ibom, so you decide that you are going to go to Lagos. Oh no, let's make it easy. You're going to go to Enugu for the conference next month. Do you just wake up and just start going? No. You're working. So what do you do first? You have to plan how you get permission to travel from your office because so you need to be excused from your office to go for this. And your excuse would include justification that you have given when I ask the question, how would you benefit from this class? Why do you want to take this class? And you talked about career path and so on. And you talked about capacity building to enhance your ability to do your work. So those are the things you put into the document that you use to apply to attend the conference. So that is the first stage. So you would have planned that you would have to do that. So that's the first part of planning. You see, you don't look at it as planning. You think it's routine. No, it's planning. And then when you finish, then you now sit back and say, okay, you look at the things that they have posted, the hotel, the registration, and all those things they have posted and all of that. Then you decide what is your budget for this trip. Now you look at the budget implications and you assure yourself that, yes, you have the budget to cover it. And you decide, okay, there is early bird registration, there's early bird accommodation and things. So if you delay, you get the higher price. But if you get early, then you get the discount. And so you then plan and say, okay, this is when the discounts will expire. I have to plan my payment and things, registration and so on, to ensure that I make that discount so I can get something back. But you also include your transport fare. How much? You look at the number of days you're going to spend there. The number of the place, if you're going to share room You get somebody, you have to talk to somebody ahead of time, find out who's going there. Can we share room and save cost also? So those are all the planning in place. And then you identify which route will you follow. Which route is the better route to follow? Is it from Uyo to Ikorekpene and then to Aba and then to Enugu? Or are you going to take go to Uyo to Calabar and then from Calabar on to Enugu? Which is the better route? What are the transport costs for those things? So you see, invariably, you are actually planning a program. The program is what? Traveling to go for a conference. So those are the things they're trying, and that's what social work programming helps you to, not only for career progression, but how to even manage the work that you do and how you do the work, as well as help you in structuring yourself at the same time. Now, to understand social work programming effectively, you have to understand a couple of theories. You have to understand a couple of theories. The first is the systems theory. Because remember, we talked about how the systems affect people and so on. And I remember I talked about advocacy that will help you address some of those systems, how you pool funds together to help address things in that system to make it functional also. So systems theory emphasizes the interconnectedness of individuals, families, groups, and communities. Programs designed with this theory in mind consider the broader social environment in which individuals operate. You see, so in other words, I use the example of blinders on. By blinders on, it means you put something on your eye to cover distractions from the corner. So you only focus on what is in front. When horses are racing, they usually have those blinders so that they don't look at other horses at the side and get distracted. So they focus in front and they run to meet those things. So that's blinders. So, but in social work, you need to remove those blinders. Because according to this systems theory, you need to see the external, the environment. Everything interplay to affect the information the person that you want to correct certain things with or you're dealing with. So blinders, that's what systems theory is. The second theory is strength-based theory or the strength-based approach. This focuses on identifying and leveraging existing strengths and resources of clients and communities rather than solely addressing deficits. And when we say leveraging existing strength. So in other words, before you start programming, you need to know what exists in the environment that this patient, this client that you want to work with is in. So that is what they call SWOT analysis. How many of you have heard of SWOT analysis? I give you an assignment, SWOT analysis. So after this class, go and review it. But I'll give you an insight. It is identifying what is available in the community and what you can use from that community to address the things that you have. Because if you don't know what is available in the community and you start identifying other resources and come to the community, you might find that your effort was a waste because they already have those in the community. So you need to put those together. The next theory is empowerment theory. This encourages participants to take control over their own lives, advocate for their rights, and participate actively in program development and decision making. Remember that you're going to people, you're going to a community and things to get something done. And most times in the communities, people throw their hands up in the air and say, well, government is not listening to us. Government is not paying attention to us. Government is not doing this. You find that people are falling sick because of cholera and things. But you go through and you see fecal materials everywhere outside, in the bushes nearby, and so on and so forth. And the people say, well, government has not provided us good sanitation. But why don't you start with yourself? So you have to work with the community and say, listen, even though government has not provided you with the good sanitation material, how about pulling the able-bodied men in your community and you dig a pit latrine? Dig a pit latrine, one for male, one for female. Depending on the size of the community, you can say two and together. And once you build it and you dig it and build it, then you get wood and things and put it on top so that it doesn't sink with people and so on. And then you now build a shed over it and you label it male, female. According to the language, Eden, Iban. You see, so that is empowering people to take action. And that is what is good with social workers, because they're able to see, because they come from outside the community, or even when they're in the community, they're able to move themselves like they're outside, but they see what is in the community and they're able to help them. That is the empowerment theory. The other one is cultural competence. Recognize the importance of respecting and integrating cultural values, practice, and experience into programming. You see, when you go to a community and you show disrespect by not doing that which the community expects you to do, you are already creating a roadblock. A good example, if you go to the community in the western part of Nigeria and you seniors, you bow down to greet them. You bow down to greet them. That's a sign of respect. And then when you go to the ballet of that community, you prostrate to greet. They welcome you and then you sit down. They listen to you. But when you go to the community and you greet seniors, like you just stretch your hand and start shaking senior, or you go to the ballet and you stand up or you greet the person and you don't prostrate, then that creates a block. And that's why you need to understand the cultural environment you're going to and have that competence to be able to. And then the last one is trauma-informed care. This ensures that the programs are sensitive to the potential impact of trauma on participants and prioritizes safety, trustworthiness, and then empowerment. When you go to a place to go and intervene in something, you do not go and create even more trauma to the people or to the person, to the client. You have to find a way to ensure that you limit the trauma that they're already facing instead of adding to it. That's what this is about. Are you guys still there? Can I hear some? I can't see anyone. My screen is not showing anyone.
We are very, very active, sir.
Thank you. I appreciate it. That's a third person, Abby. I didn't know some people have joined in, but that's okay. I'll see you in the class when I finish presenting. The next one, you see, we're talking about these things that you must have before you must understand before you begin programming. So, and you would have attended to this in various other classes in social work. So this is meant for emphasis. It's meant for emphasis to drive home the point that these are expected things that you have to do. Because I know that in some areas of social work lectures that you may have participated, you would have done issues of values clarification and all of that. But these are core values of ethics, core ethics in programming. So the core values and ethical principles in social work programming are: one, service, prioritizing helping others. That's the value you bring into the work. Two is social justice, working to create positive and equitable social change. That's why we are here as social workers. That's what we do. Dignity and worth. In other words, you're promoting client self-determination, noting cultural differences. So you're kind of letting the people know they have dignity, and you're promoting them to take charge of their self-determination. Because nobody will determine things for yourself. So you have to begin to think about what is it that you want to be, how do you want to improve yourself and things. And then you can now get the help to get to that point. Another ethic is human relations. Utilizing relationships as a tool for intervention and support. So if you go to a place as a stranger and remain as a stranger in that place, you will lose out on the connections that will give you opportunity to get someplace. Because if you develop a relationship with people, it would enhance the things you have. I'll give you an example. I was in charge of a program or a big organization that was to build 2 warehouses as part of its program in Nigeria. It was difficult to break into Abuja Municipal Council to get the things going. So what did I do? I used my relationship in my golf club to develop relationships in my golf club. And through those relationships, I was able to now leverage contacts in Abuja Municipal Council, through which it became possible to go through the process and build the house. So human relationship is very important, especially in social work, because you need that to open doors for you, to give you access, to help you identify ways of access communities and so on. Another is integrity, conducting oneself ethically in all professional endeavors. I mean, I don't need to emphasize this. I don't need to emphasize this, because if you have to go to discuss with people, you must show that they must see you as somebody who is diligent and has integrity to that they can trust, because you have to elicit trust from the people. And then competence is very essential. Maintaining current skills and knowledge to provide effective service. Yes. Solomon, you talked about this in your introduction to why you did, to be able to to get the competency to enable you to do your work well. That's what it is here. So that's one of the ethics. Yeah. So let's look at overview of programming. What do you need to do first? We talked about the various steps, or when you do SWOT analysis. One of the SWOT analysis and then would be needs assessment. Needs assessment and community analysis are critical first steps in designing effective social work programs. They ensure interventions are grounded in a clear understanding of the community's unique strengths challenges, and priorities. Because remember, we talked about leveraging the resources within the place to improve or to enhance your work. That's the need. So you have to identify those needs. And how do you identify those needs? Various methods. Data collection, very important. And let me say this, because in fact, yesterday and the day before yesterday, in a forum I belong to, I corrected people, and I'm talking people who are well-educated people. And one of the things, they easily throw data around. We're talking about journalism and the issue of Rufai and Dave Umahi, those who have seen it on social media. And I was talking about the ethics of journalism. That you have to look at the actions in the ethics of journalism, and journalists are supposed to maintain a certain ethics and so. But the outcome of that discussion was that somebody said, well, 80% of Nigerians support Rufai. And I said, wow, for you at that level to just throw out the data is interesting. I said, how did you arrive at 80% of Nigerians? Did you conduct an assessment to be able to identify that, yes, 80% of that? They say, well, that's how Nigerians. I say, well, we are educated and we shouldn't be throwing data like that. So I encourage us not to wake up and when there's an argument, say over 80%, over 10%, or no. People can argue that because you don't have any. However, if you say most of the people I have discussed with, we can't argue with that because we are not there with you and the most of the people you have discussed with. So don't use percentage. Use most of the people I've interacted with or discussed with. So back to methods of data collection. Surveys and questionnaires, efficient for gathering quantitative data from a broad sample. So you see, if you have not gathered quantitative data and you present this quantitative data either in numbers or percentages. So if you have not gathered quantitative data, I think, don't throw numbers or percentages around. Interviews allow for in-depth understanding of individuals' experience and perspective. Interviews are one-on-one that you do because it gives you a better time to really discuss and understand who that individual is and how best to. And then there's focus group discussions. These are qualitative data collection. So you come out with a report and then you can now transcribe that report and translate it into percentages using a certain strategy and so on for the statisticians. So focus groups generate discussions and insights into community perceptions and group dynamics. So this is where you meet a group of people. And when you say group dynamic, it's very, very important because if you take a group that has different age brackets in there, you are not likely to have the younger ones speak their mind or the way things are for them, where the elder ones are. But it's important to also have them like that because you then sit back and learn how the dynamic within that community. Same with having a mixed group, male, female. So usually what I recommend is if you're doing a focus group discussion, if you have time, you can do 3 focus group discussions. 1 with males within the same age, 2 with females within the same age, and 3 male and female together, and moderate it well so that it doesn't escalate into accusations and non-accusations, disagreement and not disagreement. So you moderate it. And then you have a separate one for you, depending on what the issues are. So, yeah. So that's very essential. Observations. You can sit back in some place and observe. It provides contextual information on community settings and behaviors. You just sit back and observe. So you can sit back, go to a market, sit in one place, get yourself a bottle of drink, water or thing, and just observe and make notes. Maybe from different aspects or different locations where they sell leaves, vegetables. How do people negotiate? You watch how people negotiate, how they arrive at the price, and so on. You document your findings. You go to where they sell meat, you find out how people negotiate and all of that and so on. And then it can tell you a lot about the behavior of the community right there in a marketplace. Or you may choose to go to church and just sit back and be listening, looking at how the people, how do they sit in church? Men sit separately, women sit separately. And all of that and so on, you document. Or mosque, you document those things and things. That helps you to identify the settings and behavior in the community. Then the last is the review of existing data. You cannot just go to communities and collect things and so on without finding out first, has there been data collected from this community on this, in this area and so on? Even if it's from a different area, what are the commonalities? Collect the data. So you review it and you utilize demographic records, health indicators, and previous reports to inform your analysis. Government has the Nigerian Demographic Health Survey. So it's something you can use. It's always there. Every 5 years, they come out with that. So it will tell you quite a bit. Asset mapping. Identifies existing resources, strengths, and capacities within the community. This is still part of needs assessment. Stakeholder engagement. This is where you now involve the community members themselves, the service users, and the local leaders in the needs assessment process to enhance relevance and buy-in. So because what you notice, what you may observe, and so on may not be really what to say. So if you want to find out what is needed in the community, say in the clinic, you go to the clinic to go and ask the clinicians, nurses, CHUs, and so on, what is needed. But the community may be seen differently. So the community may say, we need better trained staff in that place because of their personal experience in that area. But the nurses or the staff of the facility will not tell you that we need additional training. No, they will tell you we need instruments to work with, which is okay because that's what they need. So yes, and when you get the community to be part of that needs assessment, then when you eventually come to implement, they'll be buy-in because the community will know that their input led to that program being implemented. Now you develop a criteria for evaluating and ranking the needs. So when you finish, you now have to prioritize these needs. Which one is high? Which one is lower? So you develop a criteria for evaluating and ranking needs. Example, prevalence, severity, feasibility of the intervention. Because sometimes when you go and look at needs, there may be some needs that are completely out in the stratosphere. You cannot address that. So you're not going to allow that to now impede you because you try to bring it down from the stratosphere to come and implement. It's not going to be possible. So you have to prioritize and see which ones. And then engage stakeholders in the prioritization process because you have to clarify to the stakeholders, these are the things they are going to be doing, especially when it has to be a program that's implemented at the community for the community. And you have to make it by the community. And that's where you engage them in the process to ensure transparency and community ownership. So now you get to the point where you now start program planning framework. This is a very essential part of it. Remember, I had told you, I had given you an example of your traveling to go to Enugu for the Chartered Institute of Social Work conference. So now is the program plan. Program planning framework provides structured approaches to translating assessment. Which assessment? The one that you just did in needs assessment. Assessment data into actionable program design, the clarity, the logic of intervention, and enable program evaluation. So when you do that, when you structure those approaches, it helps you to translate the assessment, the data you've collected, into actionable things. For example, if your data shows that many women or many girls drop out of school and the idea is to get them to go to complete their secondary school education. So you have to prioritize that program, how to go and do it. Now, while you're doing this, you also have to think of another model, which is the logic model. Logic model, when you look at logic in certain things, it is not in terms of argument. It's not in terms of argument. But it's a visual representation that maps out relationships between resources, activities, output, and desired outcome. So that's your logic model. You've collected the data, and then you identify the resources, and then you look at what activities would you design. But before you look at it, you also want to find out what is the outcome you want to get to. And so that outcome will now help you map out what output will lead you to that outcome, and what resources you need to get those outputs. So logic model helps you through that process. You do that, but you don't realize that it is a logic model that you're doing in your daily activity, in your home. When you go to market, the list you develop of the things you need to buy, and how long you want that to last you in the house, depending on the number of people you have in the house. And so that interval between developing that list and the extent to which the food would last, that is a logic model all through the process. And that logic model has components. The components include inputs, resources invested, staff, funding, materials, activities, actions or interventions delivered, outputs, intangible products or services delivered, outcome, short-term, intermediate, and long-term changes resulting from the program, knowledge gain, behavior change, improved well-being. Then benefits, enhance communication, planning, and evaluation by making program assumptions explicit. For example, a logic model for a school-based bullying prevention program. So if you follow this through, it tells you something. For example, the school-based bully prevention program. What is the outcome you want to see? The outcome is the stoppage of bullying in the school. So if there were 10 incidents of bullying in the school every month, and your program wants to reduce, the outcome you want to see there is prevention of, zero, you want to see zero bullying. But the change you want to see, that's the output. The output is prevention of that. But the change you want to see is in the behavior of the people going forward. That's the change. The output is number of bullies that have reduced to 0, from 10 to 0. The real change is in the behavior of the people, of the bullies, that has now stopped completely and going forward. So it is not that they stop because somebody is watching, but they've changed their behavior. Now that is the change, the outcome that we expect. Benefits: enhance communication, planning, and evaluation by making program assumptions explicit. For example, the school bullying program. Can I stop here to ask questions? How much time is this class for? 2 hours? Hello? Can
Yes, sir,
somebody
very
let me
much,
know?
sir.
It's 2 hours.
I think so, sir. I think two hours or so.
Okay. I want to be sure, so I don't know if you guys have another lecture that would disturb you guys. So
Okay, sir. There's another lecture immediately after this, but this one I think it's for two hours.
okay, that's good. Thank you. Appreciate that. So not many people in schools in Nigeria and things and so on have realized what we mean by theory of change when you are planning a program. But within international health programs, you cannot submit a proposal for something without including theory of change. You must include that theory of change in the proposal. And what is theory of change, or TOC for short? It is a comprehensive description and illustration of how and why a desired change is expected to happen in a particular context. That is the first definition, a comprehensive description and illustration of how and why a particular change is desired or is expected to happen in a particular context. If you take the community, you have gone through and so you realize that there are dropouts from school. Girls are dropping out of school. Now, what is the particular change that is expected? Or a desired change is expected? Well, the desired change in that case should be that girls go back and complete their school, or girls are allowed to stay in school throughout. So that's the change. And that becomes your end goal. In which case, you're looking at the second one, which is the process. Begin with the end goal and work backwards to identify necessary preconditions and intervention. So girls should remain in school and graduate in secondary school. Then you work back. What are the things or the conditions necessary for them to do that? Parents must not bring children out of school early to go and marry, or to go and help their mothers in school, or feel that it is a waste of time educating a girl because you go and marry and the education is wasted on the dad, on the family, and it benefits the other family. All those things are part of the reason why girls drop out of school. But there are also other reasons in the school where girls are in secondary school and they get to their period. They're going to get to their period. And they have not understood how to manage their period very well. And so what happens? They get accidents. And when they get accidents, the boys in the class, they get abused. Oh, yes, he probably has gone to commit abortion and things, when it is not. And what happened? The girl comes too shy and doesn't want to go to school again. So these are the things that are possibly limiting the girls going to school. And your needs assessment would have provided that information. But remember, in developing the theory of change, you start with where you want to end, and you begin to work backwards. Utility is the next one. Useful for complex programs with multiple components and stakeholder. So there are some projects that are very complex. And the example I just gave with girls dropping out of school is very complex. It is not only because parents withdraw them out of school, because they don't have money, or because they're afraid that when you spend so much money and train her, she'll go and marry somebody else and won't take care of you in your old age and all that. So it's complex. Or the boys in the school are bullying and harassing them when it's their period time. So you have these different aspects that you have to take. So an example of a theory of change for reducing food insecurity among seniors is linking advocacy, service, and service delivery and policy change. I just gave that example, but these are the different things that you have to link in order to get the theory of change in process. So when you have understood this, then in your program, you set goals, objectives, and outcomes. Goals are broad and overarching statement. So you need to differentiate between goals and objectives. Because most times people use goals or they interchange it. What is your goal? What is your objective? So goals are broad overarching statements about the desired impact of the program. So the desired impact of the program is the goal. Example that we use for girls dropping out of school. The goal is to ensure retention of girls in the school throughout to graduate in secondary school class, retention to graduate. That's the goal. Objective, specific measurable steps towards achieving the program goal. So let's look at measurable steps in this case. 1, increasing the number of girls who remain in school. That's measurable. You can count it. So that's 1. Based on your this thing, when it is there, increasing number of girls who remain in school as an objective. By the time you now break it down, the activities, that's when you now have all those things outlined, the steps you're going to take and things. Outcomes. Sorry. So, outcome, the specific changes or benefits that result from the program. More girls are now in school and complete their education. But there's a SMART criteria. Objectives should be specific, measurable, achievable, relevant, and time-bound. So you start your objective. By the end of the project, that's time-bound. You have a 5-year project. By the end of the project, we will have retention or more girls will be retained and complete their school certificate than it is. Objective clearly outlines that. So your goal is that, but your objective is specific so that you can count them. It should be achievable. It should be achievable because that's what you got money for, to implement that program. It should be relevant. Relevant because if more girls retain in school and educated, research has shown, and you provide that research, that when girls complete education, they're more able to take care of families better. You know. So integrating assessment with planning. Use findings from needs assessment to inform every stage of program planning. Don't just do your needs assessment and then you pick one and then use that to continue planning without looking at the interconnectedness of the different components of that needs or different findings from the needs assessment. Ensure continuous feedback between assessment, planning, and implementation. When they say ensure continuous feedback, it means continue to go back and forth to be sure that you are not missing anything in the process. Very important. It's very, very important to integrate diversity, equity, and inclusion. Because in social work programming and planning, designing culturally competent programs means intentionally creating services and interventions that respect and respond to the cultural background, values, and experiences of all community members. So you don't just choose one part of the community and now we know that in our communities, there are certain people that are low class or culturally tend to be insignificant or minorities. And they have certain complexes associated with that. So when programs come, it is maybe those that are considered royalty or son of the soil and things that get that. The others are not really taken care of. But as a social worker, you need to be encompassing. So your program should cut across all of them. That is being inclusive. It's also equity to be able to make sure that they get what they're supposed to be getting. Okay. So this involves understanding and addressing the unique needs of the diverse population, ensuring that programs are accessible, relevant, and effective for individual forms, different racial, ethnic, linguistic, and cultural groups. So it is not only in a community where you have different groups and so on, and you only address one group because maybe they're the majority. But then you leave out the minority groups because they don't have the same language as the majority. That would not be a good, that would not be an inclusive program. So integrating diversity, equity, and inclusion. This requires embedding principles of diversity, equity, and inclusion at every stage of program design. Let's look at anti-oppressive practices in programming. Anti-oppressive practices means deliberately identifying and challenging power imbalance, discrimination, and social injustice within program structures and service delivery. Social workers use this approach to avoid perpetuating systemic inequalities. This includes employing participatory methods, elevating the voices of those most affected, by social issues, and continuously reflecting on one's own biases and organizational practices to foster a more just and inclusive environment. We all have biases, and those biases sometimes influence the way we implement activities, the way we do things, and so on. And as a social worker, you need to first desensitize yourself from those biases. For example, you're a social worker attached to a hospital, and a 13-year-old girl comes to the hospital to come and ask for family planning. What do you think would be the response of the nurses or the people there? We know that. We've seen that. There's immediate stigmatization. Oh, you're already sexually active? Why are you coming? So, what are your parents doing? What, at 13, you are coming for family planning? So what happens to that then? The people have allowed their bias to intimidate this girl and make her look like somebody who is not. As opposed to welcoming her, making her comfortable, and then asking why she needs it. Because you need to know the type of family planning to put her through. Are her parents aware? What is going on at home? Has she become sexually active? Even though she doesn't want to say, you may avoid that question. That's how you desensitize yourself of those biases to be able to drive home and run your program effectively. So we've dealt with 14 slides. In how many minutes? And we need the next, we have another class next Saturday, right? The next class will deal with hopefully another 14 slides to conclude the class. But do we have any questions so far? I will stop sharing so I can see how many people have been in it. Tell me, still only 2 people in this class. All this breeze I've been shooting in my mouth, it's only for 2 people. So, is there any movement for me? The 2 people in class. You have any question? Susanna?
Yes, sir.
Any movement?
Yes, sir. No, sir. Everything is clarified, sir.
Yeah, question. Okay. Afo, Iyeme? Iyeme, have you left your screen to show you were here? Meanwhile, you have dashed somewhere. You know, there's a tendency to leave your screen on. You are talking and you go to another room to go and eat something or do something, and people think you are still in the class. That's the problem with Zoom. So, but okay. So we've done quite a bit. The next class will look into, let me see. Just give me a minute. So we'll look at what the next class will be looking. Okay. Yeah. So next, we'll be talking about evidence-based practice in program design, where we'll review relative literature and best practices. We will also be incorporating research evidence into planning, and then we'll talk about program implementation then. developing work plans and timelines, putting together staff, supervision and training, and then we'll look at resource development and funding. Look at grant writing. I know there's a class in grant writing, so I don't know when that will be. And then building partnerships and community engagement. You talk about stakeholder communications, engaging service users and community members. That's more like co-creation. You hear a lot of that. That's it. And then finally, we talk about program monitoring and evaluation. And then how do you make your program sustainable and scaling? So those are the things we'll look at in the next class. I hope that we'll still have you guys in there to finish it. So I want to say thank you very much for participating in this class. So we'll give you an early leave to go on to other things. So thank you very much. Oh, thank you both.
Thank you.
All right.
Thank you, sir. Thank you, sir.
Yeah.